Tuberculosis is curable, but for millions of people, treatment is only part of the story.
Tôi là lao động chính trong gia đình của tôi. Khi tôi mắc căn bệnh này, tôi nghĩ tôi phải gánh chịu một mình.
TB doesn't just affect the body. It negatively affects income, families, entire lives. And even when support exists, it often doesn't reach people. Slow systems, paper forms, missed opportunities. Nearly 1 in 5 people in Vietnam report receiving no social support at all during their TB treatment. So we asked, what would TB care look like if it was truly people-centered? We started by listening.
Thì cái việc mà bảo vệ quyền lợi đối với các bên ở đây rất là được đề cao. Thì mình cảm thấy nó rất là ý nghĩa.
Together, we reimagined the system. People with TB, their families, health workers, policymakers. Through a people-centered design process, we listened, tested, iterated, and built solutions side by side. Because the problem wasn't just a lack of funding. It was how support was delivered and experienced. First, we built something new. A digital platform to better deliver financial support directly from the government to people. Faster support, fewer barriers, at scale. We explored expansion too. Could this new digital system support more than TB? Could it reach people with TB and other lung diseases? So we tested it, and it proved feasible.
Không chỉ dừng lại ở các bệnh nhân mắc bệnh lao, mà các bệnh nhân mắc các bệnh phổi khác cũng cần được hỗ trợ. Vì vậy, mô hình này cần được mở rộng.
We also set out to shift how TB is seen and understood in Vietnam, because stigma keeps people silent, and silence delays care. So we worked with people affected by TB to tell a new, positive story, and we launched a national sticker design competition. Young people stepped in, sharing stories of hope and healing through their designs. These weren't just cute images, they were messages of recovery and resilience.
Tôi muốn thiết kế của mình thể hiện rằng người mắc bệnh lao vẫn có thể sống, hy vọng và ước mơ.
These stories were shared across social media, reaching over 2.9 million people, and starting conversations that didn't exist before. But changing perceptions wasn't enough. For future scale-up of financial support, budget allocation and policy change in Vietnam, we needed additional evidence. So we generated it. Over 1,300 people with TB across Vietnam were randomly assigned to 2 groups. One group received standard care. The other received enhanced support during TB treatment. Cash to reduce the financial pressures, and TB clubs, safe spaces for connection, communication, and healing.
Tôi được hỗ trợ tham gia 6 buổi, nhưng tôi đã tham gia 12 buổi vì tôi rất thích được tham gia sinh hoạt ở đây.
Tôi không còn cảm thấy cô đơn, tôi có người để chia sẻ.
With time, we found that more people stayed on treatment, completed it, and supported one another. Treatment success significantly increased, and costs for the household were significantly reduced, while families invested the cash in additional food and health seeking. Because when you reduce financial stress and build human connection during treatment, people don't just survive TB, they recover, they rebuild, they give back.
Giờ tôi cảm thấy thoải mái, mọi người lắng nghe tôi.
Trước đây tôi phải đối mặt một mình, giờ thì không.
This is what people-centered care looks like. A system that listens and responds. A system that delivers. We've shown it can be done. Now it's time to scale it. Because ending TB means supporting the whole person and protecting the family behind them.